If the number of corona cases in Great Britain increases significantly again in winter, for example, the government wants to order a mask requirement again and is keeping the introduction of vaccination records for clubs or stadiums open. The measures are part of a Plan B if the pandemic cannot be kept under checks with booster vaccinations, Prime Minister Boris Johnson said at a press conference in London on Tuesday. The Conservative politician added, it would simply not be sensible to rule out such measures if they could be crucial in keeping business open. Health Minister Sajid Javid had previously stressed that the emergency plans would only be put into effect if the pressure on the NHS health service in England was unsustainable. It's fun that they always talk about England. The British government lifted almost all corona restrictions in June, but it can only enact rules for England. The other parts of the country, Scotland, Wales and Northern Ireland, are independent in their health policy. And I know that, but I have to talk to Scotland, Wales and Northern Ireland, coordinate stuff. Plan 8, according to Javid, relies on booster vaccinations for about 30 million people due to begin next week. Otherwise, the government relies on voluntariness and personal responsibility. In this way, people are encouraged to meet outdoors as much as possible, to ventilate a lot, to wear masks in crowded places and in closed rooms, and to wash their hands frequently. Companies are advised to check vaccination records. This plan shows how we are giving this nation the best possible chance to live with corona without the need for severe social and economic restrictions, Javid said. However, he emphasized, we have seen how quickly the virus can adapt and change, so we have prepared a Plan B with emergency plans. In Prime Minister Boris Johnson's Conservative Party, there was strong resentment against the introduction of vaccination certificates, so the plans were cancelled again. In the UK, by the way, people over 50 as well as home residents and caregivers can receive a booster vaccination against the coronavirus. As the government announced on Tuesday, the regulation also applies to clinically extremely vulnerable people and high-risk patients between 16 and 65 years of age. In total, more than 30 million people are eligible for a third vaccination. They should be injected with the agent from the companies BioNTech and Pfizer at the earliest 6 months after the second dose, which studies show that it works well as a refresher and is very well tolerated. Alternatively, the vaccine from Moderna is also possible. The syringe should be administered together with the normal flu vaccination, they say. Whether healthy people under 50 also receive a so-called booster vaccination should be decided when more data are available. And just one small thing, I had session of my district council this week. I had to show my vaccination certificate as a councillor. Just saying. I'll see you in my next video. Bis gleich.